Mastocytosis, also called Urticaria Pigmentosa, is a condition where the body makes too many mast cells, tiny immune cells that store chemicals like histamine. Most often, it shows up on the skin as brown red spots that can itch or swell. It is usually seen in children, but adults can have it too. Think of the skin like a canvas, where extra mast cells paint small itchy dots. The exact cause is not always clear, but most cases are linked to a mutation in the KIT gene, which tells mast cells how to grow. This mutation makes the cells multiply too fast. Sometimes the disease appears after infections or injuries, and in rare families, the mutation can be inherited. Imagine a broken traffic light that lets too many cars enter a small street. Typical signs are brownish macules or bumps that turn reddish and swell when rubbed. This is called Darier's sign. The spots may itch, burn, or cause a rash after heat, stress, or certain foods. Some people also feel flushing, stomach cramps, diarrhea, or even anaphylactic reactions if many mast cells release their chemicals at once. Picture a tiny firecracker under the skin that pops when you press it, causing a localized flare-up. Doctors diagnose mastocytosis, by looking at the skin, performing a skin biopsy, a tiny piece of skin examined under a microscope, and checking blood for high tryptase levels, a marker of mast cells. Treatment focuses on controlling symptoms, non-sedating antihistamines, mast cell stabilizers like cromolyn, and sometimes low-dose steroids. For severe or systemic disease, doctors may use KIT-targeting drugs such as midostaurin, midostaurin. Think of antihistamines as putting a lid on the mast cell's chemical sprinkler, while KIT inhibitors turn off the overactive growth switch. Because the disease comes from a genetic mutation, it cannot be completely prevented. However, you can lower flare-ups by avoiding known triggers, hot baths, tight clothing, certain foods such as shellfish, or physical pressure on the spots. Teaching children to gently pat instead of rub their skin, and keeping a diary of what leads to itching can help manage the condition early. Recent research has brought new KIT inhibitor medicines that work better and have fewer side effects. Scientists are also exploring gene editing tools to correct the KIT mutation in lab models and advanced imaging to spot lesions earlier. These advances promise more precise treatment and possibly, one day, a cure.